Good afternoon, everyone, and welcome to the Office of the Prime Minister. We'll give everyone about 30 seconds. Media, stand by, 30 seconds, and we're ready to go. Good evening, everyone, and welcome to the Media Center here at the Office of the Prime Minister in Kingston, Jamaica. Prime Minister the Most Honorable Andrew Holness presided over the meeting of the Cabinet today, and he will now update the nation concerning matters arising, especially decisions on COVID-19. Prime Minister.
Thank you, Naomi. Good evening, everyone. Good evening, Jamaica. Good evening, our friends listening right across the world through this streaming press conference that is being streamed live. First, let me say that we are now at 505 cases. The Ministry of Health will give a further update later on in the press conference. But just briefly on the issue of the accumulated numbers. We've been very much focused as a society on the growing numbers. But I believe, having reached the 500 mark, that a more meaningful variable to pay attention to would be the number of Jamaicans who are in hospital, meaning the number of Jamaicans who are actually utilizing hospital space, which would be the critical measure of the capacity of the health service. And as of today, the Ministry of Health will give a further update. There are 49 Jamaicans in hospitals, and we, by virtue of our projections and plans, we put in place 315 beds. So roughly about 16% of our capacity is used in hospitalization. The figures for persons who unfortunately have succumbed to the disease remain at 9. And that, when compared to other countries in the Caribbean, I mean, one death is still too much, but relative to other countries on a per capita basis, Jamaica has fared fairly well. Certainly in terms of testing and other measures, Jamaica has fared well. But in terms, the critical variable would be the number of patients under hospitalization, and that is presently at about 16%, and I think that is showing, it's a fairly good showing for Jamaica. We have had to tighten our curfew hours over the last 2 weeks as a means of ensuring that we control movement, which would interrupt any transmission that was taking place as a result of the workplace cluster in St. Catherine. It has been very effective, and I think by and large, we have, I wouldn't want to be too early in declaring any form of victory, but I think that the Ministry of Health has done a fairly good job in containing the workplace cluster in St. Catherine. And I would also say that they have done a very good job as well in bringing under control an emerging cluster in St. Mary. Having regard to that, and later on we will show our graph, which shows our curve flattening very nicely. Having regard to that, we have decided that from Wednesday, May 13th, the curfew hours will be adjusted. So on Wednesday, the 13th of May, the new curfew hours will start at 8 p.m. to 5 a.m. the next day, for each day up to Sunday, the 24th of May, 2020. Sunday, the 24th of May, 2020 would be the day before we celebrate or mark Labor Day. Labor Day this year would be on the 25th of May, Monday the 25th of May, 2020. So, for the Labor Day holiday period, which we would mark from the Sunday and on the Monday, so for the Labor Day period, we would have a tighter curfew, which would begin at 3 p.m. on Sunday, May 24th, to 8 a.m. the next day, which would be the Monday, to Tuesday, May 26th, at 5 a.m. So you will recall that we had a similar curfew period for the Easter weekend, and that worked fairly well. In fact, when we examined the workplace cluster in St. Catherine, we concluded that had it not been for us taking a tighter curfew hour during that Easter period, then the outbreak in St. Catherine probably would have been larger than it actually was. We're taking that similar approach. The Labor Day weekend would have been a period of time in which our persons would have been taking the opportunity, probably some to go to the beach, which are closed, or to water parks or rivers, which are also closed, or to have parties, which are not permitted. So what we're going to do, as we did for the Easter weekend, is to have a tighter curfew, which would start on the Sunday before Labor Day, and the curfew hours would be on Sunday the 24th of May at 3 p.m. to 8 a.m. the following day, which would be Monday, Labor Day, and then 3 p.m. on Monday, Labor Day, to 5 a.m. on Tuesday, the 26th of May, when we would commence a new curfew cycle. And at that time, on Tuesday the 26th, the curfew would start at 9 p.m. to 5 a.m. the next day, and it will continue like that until the 31st of May, at which time we would declare a new set of orders which would give you what the curfew hours would be going forward. So if, in effect, what we have done is to gradually loosen the curfew hours So just to repeat so that we're all clear, the current cycle of curfews, which is the 6 to 6 cycle, would come to an end on Wednesday. They come to an end on Wednesday, the 13th at 6 a.m. The new curfew cycle starts on Wednesday, the 13th at 8 p.m. So at 8 p.m., everybody should be off the road. And then the following day, which would be the Thursday, they end at 5 a.m. So we have given an additional 2 hours to the close of the day and an additional hour at the beginning of the day. Then, on the Sunday before Labor Day, we start a new curfew cycle at 3 p.m. and it ends the following day at 8 a.m. and then starts at 3 p.m., that is on the Monday, and then ends on the Tuesday at 5 a.m. And then we start another cycle after that, which is at 9. So on the third cycle, we would have added an additional hour at the end of the day. So let's just go through it very quickly so that we all have it. So from Wednesday, it's an 8 p.m. to 5 a.m. curfew. Then the Sunday before Labor Day, it is a 3 p.m. to 8 a.m. curfew. And then when that Labor Day weekend is over, then the new curfew is a 9 p.m. to 5 a.m. So we are gradually loosening the curfews. We're giving businesses an opportunity to have more time. We have not specified business hours or travel hours in this new gazette, which we are about to publish. So we expect that business owners will use their discretion in terms of their opening and closing hours to allow for their staff to be able to travel within the curfew period. We have made provisions generally for transport operators, licensed transport operators, to be on the road 1 hour before and after. So they would have a longer period of time, but they would not be allowed to be transporting passengers. So in effect, they have 1 hour to be able, if you work, for example, with the JUTC, to get to work. If you are a taximan and you have to go and pick somebody up early in the morning, so you could start at 4 to 5. That's your travel time for transport. And if you drop someone off and you have to get home from 8 to 9 in the first instance, and then from 3 to 4 in the second instance, and then in the third instance from 9 to 10. So we have allowed 1 hour for transportation operators to be able to pick up their first passenger and to drop off their last passenger and get back to their own home, which I think that's fair and reasonable. We've had many requests, many complaints, many concerns raised in the press that the previous curfew hours were very restrictive, and I believe we had to do that for good reason, and you will see the benefit of it. So if you were to look at the graph in front of you, you will see 5 colored lines. The red line is a 6-day doubling, meaning that how many days it would take for your current numbers to double. In 6 days, what it would be. In 8 days, we have an 8-day line. We have a 10-day line, and a 12-day line, a 20-day line. You will also see on the graph a dotted line in black and a solid line in black as well. The black line represents the accumulated cases. So you're looking at 505 presently, and that is trending towards the 12-day doubling. The dotted line shows what our cases would have been without the workplace cluster outbreak. So you can see that we would have been tracking the 20-day doubling, which means that you would have doubled in 20 days' time from your 100th case. But we are flattening nicely. You can see that when we started, we were on the 8-day, and we have moved across to the 10-day, and now we are on the 12-day doubling, which is where we would want to be. Ultimately, we want to get back on the 20-day doubling curve, but that would depend on how well we keep faith with the measures that are put in place. So, as a result of the flattening of the curve, we believe that we can give some space to our economy. We can give some space to economic activity. But that is always conditional. If we see where the numbers are trending other than where we want them to go, then we will have to go back to even tighter measures. So I take the opportunity to say to Jamaicans that it is really in your hands. The government stands ready to put in place the measures to ensure that our curve is flat and remains below the health capacity. I started out by saying we have 315 bed spaces available, inclusive of high dependency units and ICU. We have 49 persons in hospitalization at present. So we are doing everything to ensure that if there were to be a surge, a spike, an outbreak, and people are in need of care, that we would be able to treat them and it wouldn't create a crisis. But that all depends on the rate of increase in new cases. So, if by us opening up a little bit more and relieving the curfew hours, people decide that instead of going straight home, they are going to do unnecessary things and do things that are not productive, not maintain the orders, and get ill and require treatment, and we see an explosion in cases, and more people require treatment, and we are not able to provide, that is what would create the crisis, and we're trying to avoid that. So, yes, we have to ensure that our economy is working at full capacity, but we also have to appeal to our Jamaicans to ensure that we maintain the orders, we maintain the recommended hygiene practices, and we are faithful and responsible. Now, to this regard, we did not place specifically any restriction on churches. However, the church community voluntarily complied, and I must commend the church community for being faithful and responsible in how they have conducted themselves. They have stuck with the various gazetted orders. And on Friday, I met with a representative group of church leaders, and we agreed, with the support of the Ministry of Health, that some provisions could be made that could see services being held, but under strict guidelines. How we intend to do this is that we will try the measures which I'm about to announce for 2 weeks. We will observe how faithfully they are being implemented, and if it works, then we will have them as a permanent feature in the Gazette. So, one, we're proposing that effective Sunday, May 17th, 2020, churches may resume within a context agreed with the faith-based community. The physical distancing rules to apply within the sanctuary or worship space. And that is, we expect that a ratio of square footage to persons will be maintained, that is 1 person per 40 square feet. So this will determine the number of persons that will be in the church space at any one time. That roughly approximates persons being arm length apart. So 1 arm's length apart, and then the other person's arm's length apart. So that would ensure that, for example, if you were in a church hall of 1,000 square feet, that you would have just over 20 persons within the hall. Churches will be required to do temperature checks on entry. The social distancing rules would continue to apply throughout other church spaces and within the sanctuary space of the church. And of course, the social distancing rule is that you must be minimum 6 feet apart from everyone. If you're in the churchyard, if you're in your vestry, the pastor's office, wherever you are, 6 feet apart. The gathering rules apply for all other spaces outside of the sanctuary or worship space. Now, some churches, they have their church hall, but they have a space for community activity. They have a space for a little basic school. The gathering rules apply. The only place they don't apply, which would be the minimum 10 persons, would be in the space of worship. And in that event, what will apply would be the physical distance, which is the square footage demarcation. So within the churchyard, the front of the church, the entrance area, no more than 10 gathered. And if you're gathered, you must be 6 feet apart from each other. Everyone must wear a mask in the church. There must be a program of sanitization in place. That means that they should have hand sanitization stations at strategic areas, particularly at the entrance to the worship hall. We have said to the churches that it may be that they would have to have more than 1 service per day. Most churches probably have 2. They may have to go to 3 or 4. We have asked that they consider shortening the length of the worship. That might be difficult for some, but I know that they're going to try. They should ensure that there is no overlapping of the service. So one congregation comes in for a particular service, they leave, give enough time so that they can sanitize the church hall, and then another congregation comes in for their second service or how many other service they wish to have. We have asked that for this trial period that we do not assemble a choir. And that the other rituals and practices that would require the close contact of worshipers, that they should consider as much as possible during the trial period of 2 weeks, not having those rituals. So the normal peace greetings and hugging and those things you might want to consider not doing within this period. I know that the church is eager to get back to the normal way of worship, but I think we have to be cautious in how we do this, and if they have been as faithful and responsible in how they have conducted themselves during the initial period of the outbreak, and I know the churches will apply the same level of management to these new protocols. We will be observing it very closely to ensure that there is no outbreak. We have also said to the churches that where they use air conditioning, that they should turn off their air conditioning and open all their doors and windows. So these measures, my text had said Sunday, May 17th, but obviously that is an error, Attorney General. It would start on Saturday, May 16th. So these measures would start on Saturday, May 16th. I'm going to ask Minister Mackenzie to join me. We dedicated quite a bit of time today to finalize the measures for the reopening of community bars. And I'm going to ask Minister Mackenzie just to give you the scheme, the framework that we have put in place to facilitate the reopening of community bars.
Thank you. Thank you, Prime Minister. It is a position, Prime Minister, that I know a lot of people is anticipating at this time. Commencing tomorrow, we will give notice to all operators of community bars. We're asking these bars to take into consideration the protocols that are being outlined as to how they will commence operation within the framework that I'm about to announce. We are expecting that when the announcement is made, that bars will be open from 11 a.m. commencing the 19th of May and will remain open for 2 weeks. During that period, we will assess the operation of these bars along the following lines. The social and physical distancing must be maintained. We are expecting that no more than 5 persons, including the bartender, shall be in the bar at any one time. All seating arrangements outside the bars must be maintained. Physical distances of 6 feet between each single seating unit. There shall be no stools, no benches, chairs, nor table for persons within the bar. There shall be no group games, domino, etc. inside the bar or on the premises occupying the bar. Poker boxes and other such gambling and gaming instruments must be placed at least 6 feet apart to ensure social and physical distancing. There shall be no events that promote social gathering, such as parties and round-robin events. Bar doors and windows shall remain open during the operating hours. It is required that all persons operating and attending the bars must wear face masks. Bartenders, we would encourage persons working behind the counter, if possible. If you can get a face mask, we would encourage you to wear a face mask, and also that protective clothing be worn in the execution of the duties inside the bar. Each bar must establish a sanitation station for proper washing of hands and maintaining sanitation protocols that will be set out by the Ministry of Health and Wellness. All bars are asked to display proper signage to advise persons of the protocols that will operate. The Jamaica Constabulary Force, the Municipal Police, the Social Development Commission, and the Ministry of Health will inspect and ensure that all these protocols are observed. We are also going to use the opportunity to encourage operators of these community bars to ensure that they are registered, and we'll be making arrangements at all municipal offices across the country for persons to go and get registered, and we'll be working a protocol with the Ministry of Justice to ensure that we regularize the operation of all operators of bars across the country. This method of inspection will last during the 14 days, and we are going to ask operators to ensure that they comply, because failure to make the system work will probably prevent us extending the period of operation for these bars. I want to use the medium also to say to those persons 65 and over, the order requires that you stay at home. We're going to be encouraging that age group to try and resist the temptation of the spirit. but I urge operators of these community bars and other such bars to work with us and to seek clarification as to how we proceed. So the period of inspection, you will ask to put in place immediately all that I have outlined to meet the 19th of May, which is expected to commence operations.
Thank you, Minister Mackenzie. I wish to state that the economy around bar operations is significant. There are estimated approximately 10,000 bars. I'm told by other persons who know that I'm underestimating the number. I'm not expecting, indeed, that all 10,000 would be able to reopen. Some of them may have been decimated by the fall off in economic activity. They may have no stocks or be able to reopen when the opportunity is given. But those that intend to and those who can, I would want to re-emphasize what Minister Mackenzie has said, that this is a probationary period. We're giving you 7 days notice to be able to put in place the measures. The Ministry of Local Government has mobilized with the parish councils to do very quickly the inspections. And then once operations begin, it is going to be additional pressure on the Ministry of Health, but at least sample inspections will be done to ensure that there is compliance, and the Ministry of Local Government will continue to do the inspections from the local government side to ensure that the orders that are given as it relates to the numbers of persons who can be within the defined bar space, gatherings outside, no tables and chairs within the bar space, that the bartender is wearing the appropriate protective gear, particularly their masks, that these measures are observed. Again, it is a risky action to take. Government acknowledges that. But it is the role of the government to weigh risk. And we are seeing that the lack of economic activity is having a serious impact on households and communities. And as much as possible, we have to allow business to continue while we put in place the measures to manage the spread of the virus. So I believe that the measures that we have put in place, which will be gazetted and fully discussed in Parliament tomorrow, I believe that those measures should mitigate the risk. But the biggest element of mitigation is the responsibility of persons who own and operate bars and those who use them. Now, there is a level of contradiction in that, Minister, because when one is inebriated, the level of responsibility goes down. But it is being seriously observed that if there is any transmission whatsoever that is linked to any such facility, immediately we will have to revert to the original position, which is to close the community bars. So it is all up to the persons who are economically dependent on the bars to ensure that the measures are maintained. And as I'm on the point of responsibility, whilst the information I have is purely anecdotal, I don't have any verified information, but it would appear to me that there was some level of irresponsibility in terms of some persons in the affected areas of St. Mary, which would have contributed to the emergence of a cluster. And I wish to appeal again to all Jamaicans that we have to be responsible. If you are ill with flu-like symptoms or respiratory symptoms, or you have the symptoms commonly associated with COVID-19, persistent cough, if you are sneezing, sniffling, this kind of thing, then you should stay home and isolate yourself. If you have come into contact with someone, then you should stay home and report. We have had reports of persons who have been confirmed, who have come into contact, and they are moving all around communities. They are taking public transportation. It is selfish behavior. It is careless behavior. And I have to use this platform again to say that as we open our economy back, trying to seek a new normal, that a part of that new normal has to be a higher level of personal responsibility. The Ministry of Health, through their surveillance and intelligence gathering relative to the COVID-19 situation, advised the government that given the circumstances at play, that it would be in the interest of the community to quarantine certain areas in St. Mary. So the quarantine period began from 6 a.m. on May 7th, 2020, and will end at 6 a.m. on May 21, 2020. Of course, this is subject to whether or not there are more cases being identified and if there is a growing outbreak in the area. The quarantine areas would be Anota Bay. The area spans 1.81 square kilometers, and it is bounded by an 8-kilometer perimeter. It runs east from its start point at the intersection of Gibraltar Heights Road and the North Coast Highway, and heads into a northerly direction to the coastline. Then north, it will run in a westerly direction along the coastline for approximately 1.68 kilometers, then along the coast, the North Coast Highway for approximately 1.65 kilometers to its junction with a minor road. Then west, it will continue in a southerly direction along the minor road for approximately 0.18 kilometers to its junction with another minor road at the southwest corner of the Gray's Inn Sports Complex. And then south, it will run in a generally easterly direction along the southern boundary of the Gray's Inn Sports Complex and the Gray's Inn Great House, following the minor road for 2.59 kilometers to its junction at Fort George Road, thereafter following an imaginary line which will run to the north of the Ross Drive community, ending along the Gibraltar Heights Road. The boundary will then follow Gibraltar Heights Road in a northerly direction to the start point. There's the Junior Penn area, which is part of Enfield. This area spans 0.47 square kilometers and is bounded by a 2.24 kilometer perimeter. And that area will be starting east. The boundary will run from a point along the Enfield Main Road for 0.23 kilometers north of the Junior Penn Bridge, east for 40 meters, then in a northeasterly direction for a distance of 1.3 kilometers. It will then go north in a westerly direction from approximately 0.3 kilometers across the Enfield Main Road to an open lot west of the said road. And then it will go west. It will continue in a southeasterly direction for a distance of approximately 1.42 kilometers to a point west of the starting point, and then south. The boundary will then continue in an easterly direction to the start point at the Enfield Main Road. And then for the Epsom-Dover quarantine area, this area spans 0.83 square kilometers and it's bounded by a 5.34 kilometer perimeter. Starts east, the boundary will run from its start point where the Dover to Portland Main Road intersects the parish boundary in a northerly direction along the parish boundary for a distance of 0.23 kilometers. Then it will go north. It will then run in a westerly direction for approximately 2.29 kilometers to the northwestern boundary of a property north of the Dover to Portland Main Road. Then it will go west. The boundary will then continue in a southerly direction across the Dover to Portland Main Road for a distance of approximately 0.34 kilometers. And then south, the boundary will then continue along an imaginary line along the southern outskirts of the community to the dry gully south of the start point, and then in a northerly direction to the start point. Now, subject to the purpose of obtaining necessities, each person who is in a specified area shall remain at an abode or place of residence, which includes the yard, in a specified area. So what this means is that everybody should stay inside, unless you have to move about for the necessities of life. And the necessities of life means just that you need to get food and medicine or medical attention. Well, if you have to get the resources, that means you have to go to the bank or the credit union or the ATM or the remittance office to collect the cash to buy, then that would be considered to be a part of the necessary movement. Now, for the purpose of obtaining the necessities, food, medical supplies, and access to financial services, the person may travel to the closest practicable location where necessities can be obtained, and then immediately return to the abode or place of residence during the hours of 8 a.m. to 4 p.m. on Friday, May 8th, 2020, that just went, on Saturday, May 9th, 2020, today, well, Monday, May 11th, 2020, Wednesday, May 13th, 2020, Friday, May 15th, 2020, Saturday, May 16th, 2020, Monday, May 18th, 2020, and Wednesday, May 20, 2020. So that means that you are allowed to move about for the necessities of life between 8 a.m. and 4 p.m. on the days we have just specified. And those as we had previously described them, were the shopping days, as we did in St. Catherine. And just to repeat, so the shopping days would be Friday that went, Saturday that went, today, May 11th, then it would be Wednesday, May 13th, Friday, May 15th, Saturday, May 16th, Monday, May 18th, and Wednesday, May 20th. Of course, a person who is seeking urgent medical care may move about with someone accompanying them if it is necessary. And of course, a person who has attained the age of 65 years or more, or who is pregnant or who has a disability, can have someone assist them in moving about. It is always a good idea to move about with your identification. The stocking days, similar to what we had put in St. Catherine. The stocking days would be on Thursday, May 7th, Sunday, May 10th, which already went, tomorrow, Tuesday, May 12th, Thursday, May 14th, Sunday, May 17th, Tuesday, May 19th. And the stocking time would be between 8 a.m. and 4 p.m. For the purpose of travel through Onoto Bay without stopping in the quarantine areas, Friday, May 15th, 2020, Monday, May 18th, 2020, and Wednesday, May 2020. Now, markets in the specified area shall remain closed. Pharmacies in the specified area are allowed to be open on all the days of the specified quarantine time between the hours of 8 a.m. and 4 p.m. So if anyone is ill, need medication, pharmacy is always open. Markets, corner shops, petroleum filling stations, where they exist within the quarantine area, banks or other financial institutions as defined in the Banking Services Act, credit union businesses operated by societies registered under the Cooperative Societies Act, and any other place other than the market engaged in the distribution of food, medical supplies, or sanitization products in the specified area may operate only between the hours of 9 a.m. and 3 p.m. On Monday, May 11th, 2020, Wednesday, May 13th, 2020, Friday, May 15th, 2020, Monday, May 18th, 2020, and Wednesday, May 20, 2020. But in the case of supermarkets and any other place engaged in the distribution of food, such other operations shall only be for the purpose of restocking and making external deliveries, but not for the admission of services of customers at the business place. What this is effectively saying is that the businesses that I have just named, supermarkets, corner shops, filling stations, can only open to serve the public on the shopping days. On the restocking days, they are closed to the public, but they may receive goods or make external deliveries. Restaurant and cook shops in the specified area may provide takeout and delivery services between the hours of 8 a.m. and 4 p.m. on Monday, May 11th, 2020, Wednesday, May 13th, 2020, Friday, May 15th, 2020, Monday, May 18th, 2020, and Wednesday, May 20, 2020. They may, however, not serve food for consumption at their business premises. Ladies and gentlemen, so far we have seen roughly 16 cases in the St. Mary area. The Ministry of Health may give an update to that figure, which I'm about to call on Minister Tufton. But before I do so, let me just give an update. I've asked for a report from the Permanent Secretary in the Ministry of Labour and Social Security. She updated me just before I came here, and that they have so far delivered 1,400 packages to the Dover, Enfield, and Annato Bay area. They are programming to deliver, starting tomorrow, another 2,000 packages, and we are seeking to ensure that we do regular deliveries to the area to ensure that the persons who are under quarantine have access to food. It is always a difficult time when we place communities under quarantine to ensure that we capture every family in our database and that we can accurately distribute the food. I've seen reports where it is being suggested that families are being deprived of food because they do not have a TRN. I personally inquired of this from the Permanent Secretary, and I was assured that that was not the case. Indeed, it is not the policy of the government. However, the very persons who would raise the criticism about the request for a TRN number or some form of identification upon receiving the package, those would be the very same person who would readily criticize the government for having no accountability for the distribution of the items that we give. I want it to be absolutely clear that whether it is the CARE program where we are giving out money or through the Ministry of Labour and Social Security where we give out food, everything comes at a cost to the taxpayer. And even after this period of crisis, every cent that we spend will come under scrutiny by the same people who criticize us. And therefore, we must have in place systems and mechanisms to ensure that with the scarce resources that we have, that we know that if we give one household, we don't end up giving that household 3, 4, 5 times when there is another household that doesn't get. And so the government is being very careful to put in place systems of accountability, that whatever it is that we're giving out, at the end of the day, we should be able to trace back. We should have a paper trail to say Mary Jane got and Tom Stroke got. And we must see a signature and at least some form of identification to verify that signature. And I would be very disappointed if it is that there is a suggestion that because this is a time of crisis, we should dispense with accountability. It is indeed in a time of crisis that you need to ensure that you have responsive systems, but at the same time, accountable systems. Because for the little to spread, you have to ensure that those who are greedy don't take away from those who are needy. The reports I've received from the persons who are under quarantine is that whilst there might be those who may seek to create mischief, and without questions, there were some deficiencies on the part of the government in the execution, but they were not fatal deficiencies. They were remedied very quickly, and it is not as if the government set out to deprive the people yes, we take the criticisms, but I want the people of Dover, Enfield, and Anatomy, a place that I have a special place in my heart for, having worked there in many of campaigns and have made very good friends there, that I'm going to do everything within the scope of my authority to ensure that your needs are met. Don't worry. We will move with double speed to ensure that we bring you your care packages and that you get through this quarantine safely and without any undue dislocation. Indeed, I was actually very surprised because the message I got from the people of Anata Bay is that I did not go on radio quick enough or television quick enough to speak about their quarantine and read out their quarantine orders, because they want to know that the government is paying attention to their needs. So yes, the government is paying attention to your needs. And as I said before, you have my assurance that the care packages are there. I was also assured, I saw another report, that people were not able to fill their prescriptions. And I have inquired of that as well, and I'm assured that arrangements are in place for, is it JADEP? And the NHF and the mobile, you would speak about that, Minister, and their mobile team is out in the community ensuring that prescriptions can be filled. So if there are issues, we want to hear about them, yes, but I want the people of Anata Bay and the people of Jamaica listening to be assured that, you know, the government isn't setting out to deliberately deprive anyone of anything. Government is working very hard, and as soon as we hear of an issue, we're going to work very hard to correct those issues. So with that, let me invite the Minister of Health to give his report.
Thank you very much, Prime Minister. In the last 24 hours, we have had 3 additional persons testing positive for COVID-19 in Jamaica. There are now, therefore, 505 confirmed cases on the island. The 3 new cases are 2 males, 1 female, with ages ranging from 19 to 28 years, so relatively young persons. All 3 persons are imported cases from the recent group of repatriated individuals who are now based in St. Anne. So this brings to 6 the number of positive cases that came in, and this is, of course, the organized flight from the UK. And, you know, Prime Minister and colleagues, it justifies the position that the government has taken in terms of the institutional quarantine of these individuals. Otherwise, we would have another set of challenges on our hands. So I think it's important to note that. In terms of classifications, we normally give this 41 imported cases based on the additional cases recently. 190 cases are contacts of confirmed cases. 24 local transmission cases that are not linked to a known positive case. 250 under investigation. 224 of those under investigations are linked to the workplace cluster in St. Catherine, and there are 26 others. Some 304 or 60% of the confirmed cases are females, and there are 40% or 201 males, while the ages of all confirmed cases ranges from 2 months to 87 years. The recovery over the past 5 days has been a lot more improved, in that we now have 90 Jamaicans who have had COVID-19 who have now been certified as now being healthy. In other words, they have done 2 tests that are negative within a 48-hour period. And I want to just deviate a little from the script to highlight the fact that we expect the overwhelming majority of Jamaicans who contract the virus to recover. It's not a death sentence, and again, I repeat that we should not treat those who return to their communities in a manner that discriminates against them. Once the clinicians verify the negative tests and clinically release them from the institutions, whether hospital or otherwise, it means they are safe to return to their communities. And we want to appeal to community members, relatives, friends, to allow them to be reintegrated and be treated just as they would prior to being diagnosed with the virus. Tragically, 9 persons have passed as a result of COVID-19. All have had underlying conditions, hypertension, diabetes, a range of other ailments which has compromised their immune systems, which again is worth noting that as Jamaicans, we must know our health status, and for those who have underlying conditions, we should be extra careful because that's when the virus is most effective, which means that's when they're most in danger. So 9 to date have suffered from the virus. In terms of community quarantine, the Prime Minister spoke to Dover, Enfield, and Onoto Bay in St. Mary, and those communities, of course, remain under 14 days quarantine. The Prime Minister gave the specifics of the boundaries and what was allowed or not allowed during this period. I just want to outline a couple of things. As it relates to medication, the National Health Fund, which is the agency of the Ministry of Health and Wellness and government authorized to procure and deliver through our drug serve windows. They have mobilized. In fact, I was there on Saturday and saw the mobile unit delivering, filling prescriptions in Onoto Bay, in the town of Onoto Bay. I just want to give the details of the delivery of medication. So they will accompany teams, this is the NHF mobile unit, on the days and time as announced. Now, Enfield, Tuesdays, 9 a.m. to 12 noon. Dover, Thursdays, 9 a.m. to 12 noon. And Onoto Bay, Saturdays, 9 a.m. to 12 noon. And as I said earlier, I was with the team on Saturday, and the NHF truck mobile unit was very much in Onoto Bay during that period, handing out or filling prescriptions. So citizens should just bear these times in mind. If they need additional information, there are enough persons on the ground who can provide further details on that. I want to also say, as it relates to the quarantining of those 3 communities, that the contact tracers and the Ministry of Health employees have been on the ground. I spent a little time with them on Saturday. We had 70 such workers in the field as contact tracers. And by the way, these are persons who occupy other substantive positions. So they are public health inspectors, public health nurses, community health aides, and others who have been reassigned because they are trained so to do contact tracing. And it really takes a lot out of them to do their existing work, while at the same time being reassigned to doing this kind of work. And I just want to report that so far, they have assessed some 3,022 persons in the 3 communities. Number of persons sampled based on that assessment, 84. Number of samples for which results have been received, 66. They've had 2 positives from that number, and of course the balance, 64 negatives. And they have 18 tests that are pending. So just to say that the team are active, they're on the ground, they're in the communities. I got the distinct impression that the residents of these communities, certainly in Dover and Onoto Bay, where I was on Saturday, are very receptive, very cooperative, and I want to just recognize them and encourage that similar level of cooperation. The Prime Minister also outlined that the Ministry of Labour is providing care packages, and we collaborate with them so to do, and that will be an ongoing exercise. In terms of individuals in quarantine and isolation, there are 422 patients in isolation. 126 persons of interest are in quarantine at a government facility. In terms of testing, so far we have done 7,271 samples, with 6,712 being negative, 54 are pending. 170 new samples were tested in the last 24 hours. And again, I think the team has demonstrated significant additional capacity in terms of testing. We are now, certainly in absolute numbers, the leading country in the region as it relates to the numbers of tests administered, and in terms of a proportion of our population, we're somewhere in the region of about 6 of the 14 or 15 countries, as I am told a few days ago. That may have changed, but we have definitely improved the testing. The additional reminders the Prime Minister has dealt with, please recognize the protocols that we have advanced, the social distancing, the hand washing, and all the other important issues. And if there are other things that you require information on, please remember to call the 888 One Love number. Thank you.
Thank you, Chris. I'm going to invite Minister Johnson-Smith to just give a very quick update on the controlled re-entry process or any other matter that she would want to bring to our attention while she comes to the podium. As it relates to St. Mary and other parishes in Jamaica, I'm getting many complaints about funerals and the size of the mourning party. And literally, when I say mourning party, again, that is a term that might not be appropriate, because I gather there are parties at funerals, and that should not be allowed. And I'm using this platform, as you would know, that a funeral featured quite prominently in the first case that we had, and several others after that. I know in some of the rural parts of Jamaica, the funeral ritual is very important. We understand that, but I urge you to have a level of responsibility to ensure that you observe the rules, no more than 10. Tomorrow in Parliament, I will go through some of the protocols in place under the Act to address the issue of funerals.
Thank you, Prime Minister. I will just very briefly, in respect of the controlled re-entry program, advise that we have close to 7,500 applications now through the Jam COVID app and website. And I will just use the opportunity very, very quickly to reiterate that because of the number of applications and because we are managing controlled re-entry based on the amount of quarantine and isolation capacity which we have in Jamaica, there will not be an immediate response to your application. You will get your case number. That means your application is submitted. You don't have to keep applying in order to hear from us. Once you have a case number, it is received. But the process, the time that will take you to get to to conditional approval and ultimately to approval, where you would have made travel arrangements, will take a bit more time. So we're asking again, yes, for your patience and understanding. If you keep applying, then you might actually prejudice your application, because you're going to have multiple hits against your passport and it might raise questions. So if you have a question, use the support link, but do not keep applying. I also want to advise that there are 2 flights that will come in from the United States on Wednesday. One will come from Fort Lauderdale and one will come from New York. Both are fully booked. 96 Jamaican nationals in each flight, all returning, having gone through our process with the overseas missions, that is our Consulate General in Miami, our Consulate General in New York, and our embassy in Washington, which have worked together with the Consular Department in Kingston to identify the vulnerable and hardship cases and those persons with particular challenges to return to Jamaica. And we look forward to welcoming them in accordance with the protocols that have been agreed. I also wish to advise, we've noted that there have been some questions arising out of the arrival of a diplomat on last week's flight from the United Kingdom. So I wanted to just give some context to clarify the circumstances within which she arrived. And this is to advise that when travel restrictions had started, but before Jamaica's borders were closed, Ministry of Foreign Affairs and Foreign Trade, in our engagement with the diplomatic corps, the residential diplomatic corps, had been asked whether we would facilitate re-entry for diplomats critical to the operations of missions where they were impacted by travel restrictions. And in light of the international obligations of the host country to ensure the operations of residential missions, the matter was taken to Cabinet with the support of my ministry, and it was agreed that we would facilitate their re-entry subject to their agreement to adhere to the relevant health protocols, including quarantine for at least 14 days within the custody and responsibility of the relevant diplomatic mission. So we developed a form and a process which ensured that health would be aware of and would approve the relevant entry as well. Since our borders were closed on March 24th, the diplomats who have been approved and who have arrived are the Ambassador of the United States of America, a senior United States security official, as well as the head of consular affairs of the British High Commission. And that is the last person who I believe was captured on one of our TV channels. And she was seen being placed in a vehicle belonging to the British High Commission, where she was taken within their custody, where she remains at this point in time in isolation, as their process is. I'm also advising, in anticipation, that there will be the defense attaché from the Canadian High Commission who will arrive on Wednesday on a repatriation flight, which is arriving from Toronto. So these, so if you do see someone who does not appear at first blush to be Jamaican leaving in a diplomatic car, that person has been approved by virtue of this process as well. Prime Minister, thank you.
Thank you, Minister. I believe we are, we have extended ourselves, so if you have questions.
Indeed, thank you, Prime Minister. Of course, our media partners do have questions this evening. We already did our technical tests and spoke with our media partners, and so let's then just go straight to the question. Our first person would then be Brittany Clark from Nationwide Radio. Brittany? And we ask that once you are identified, you just unmute your mic so that we can begin.
Hello, good evening. All right, so my question is, CXC, that's the Caribbean Examination Council, says exams will happen in July with e-testing and paper-based testing in countries where e-testing is not facilitated. So what are the measures that we, Jamaica, have in place to host or facilitate these exams?
I'm the right man here to answer your question for you.
Thank you very much. Well, the fact of the matter is that, as you know, meeting was held on Friday, and our permanent secretary represented us because I had to attend a meeting of the cabinet, and indicated to the ministers of CARICOM that whilst they have decided to go with the exam in July, Jamaica could not endorse that date because, as you can see, what has been happening here, as the largest Caribbean island that has been affected to the extent that we have, our situation is somewhat different to some of the smaller islands, smaller states. So the challenges are much greater, and we don't feel that we could make a commitment to hold those exams in July under the circumstances. So we are examining very carefully all our options and what possibilities exist for us to give our students the best opportunity to engage the process, having come out of a very challenging few months. And they're still engaged in a very challenging situation, but we are very satisfied that we will come up with the right answer. And in consultation with the Prime Minister and the Cabinet, we will discuss the matter more fulsomely and arrive at a position. But at the moment, we have to reserve on the decision taken by our colleagues in the Caribbean, and you will be advised very soon, very soon.
Thank you, Ms. Clark. Let's go to Dion Jackson-Miller from the Radio Jamaica group.
Thank you so much, Naomi. Two questions. The announcement that the $31 million donation by Gordon Booth Stewart will be paid into the Consolidated Fund to then be earmarked for the Constituency Development Fund and then paid out to the 63 MPs for COVID relief has raised some governance concerns. Does the government appreciate the concern about the use of the Consolidated Fund as a channel for what is at its essence a private donation to politicians, both government and opposition, and what's the legal basis for allowing this? My second question is, isn't it ridiculous really to be telling people who are going to a bar to drink that they should wear a mask?
Well, my statement was that the person who is serving, I believe we had said, must wear mask and the appropriate protective gears. You know, there is a certain contradiction in it, because I don't know that you can drink with a mask. But I believe what we're trying to achieve would be that you should at least have your mask at hand. And if you are not drinking, you should at least wear it. In other words, it's a personal responsibility. And yes, some of the measures, you know, may seem ridiculous, but if you apply them faithfully, you could very well save your own life and preserve your health. So, you know, it is what it is. And we encourage people to wear masks, use them smartly. Clearly, you can't drink and wear a mask. So if you're not drinking, then wear a mask. And better yet, don't drink. So the other question, the government looked at the issues that were raised, and it is not unusual for grants to be given, for estates to be bequeathed, and the value of which is captured in the Consolidated Fund. There are concerns. I've seen articles and tweets written, and there might be some value in it, except that I would be careful in the characterization that the money is going to politicians. There is always a residual fear that somehow the CDF is a trough for politicians to place funds in their pockets. Let me say that, speaking from my administration, the CDF falls in the office of the Prime Minister. And I have ensured that as far as possible, that all the accounting standards are maintained. Indeed, the CDF is audited on a regular basis. There are some weaknesses we have picked up, and we have ensured that where those weaknesses have been identified, we have corrected them. And I have been to great pains to say to MPs that we mustn't make it seem as if the CDF is the private domain of MPs. The resources goes to constituencies, and they are expended on the recommendations of the MPs, but it is a government agency that actually draws the check and executes the program. So the resources go to the people, and I want to emphasize that point. It goes to the people, which is why you have said earmarked, but we have specified that it has to go for specific activities. And I believe that with all the measures in place, there should not be any issue about probity and accountability for the use of the resources.
Thank you, sir. Let's go over to Althea Saunders at the Jamaica Observer.
Hi, good evening. My question is about the persons who were repatriated last week. Are any of the individuals who tested positive for COVID crew members of the Marella Discovery 2?
Yes, the short answer is yes. There are two. They would have come from two ships, or from, yes. But my understanding is from two ships. But yes, some of them would have been from the Mariella too. Those who have tested positive. Well, all of them you have confirmed. The Minister of Health has confirmed. All of them are from the Mariella too. I mean, I don't want to raise the issue as to why it is that the government just has to be very careful. There is a narrative emerging that somehow the government conspired against its citizens not to grant entry and then to somehow delay their re-entry. I don't want to go into all that has happened in the back channels to make the flight possible and to repatriate our Jamaicans. It will make an exciting chapter in a book, maybe a couple of years from now. But the government utilized its good offices and called upon its friends to ensure that we were able to get our Jamaicans back. And it is not any ill will that we are trying to spite or punish to have persons who are repatriated in state-run quarantine facilities. It is for this very reason that even though they may not show symptoms, they may even have a certificate upon leaving, but somewhere in the airport, somewhere on the plane, that we have to insist upon this. Now, it might not be possible to insist upon all 7,500 in state quarantine. But until we have a mechanism that could ensure that if we give persons the options to be held in home quarantine and that they will maintain the home quarantine faithfully, then we have to pursue this line of the state quarantine. Whenever anyone is given any exemption for a home quarantine facility, that is checked. We would have to have security forces alerted to patrol to make sure that nobody's coming out of their homes. We would have to ensure that the facility is such that the quarantine in the home can be maintained and no one else is at risk. So it is, as I said earlier, it is what it is, that 6 of the persons who have been repatriated have tested positive. And it could be more, given the testing that has to be done. But when we repatriate our citizens, each and every Jamaican has to understand the risk involved. And we are managing the risks. Because this is what it is. It is the Disaster Risk Management Act under which we are operating. So we have to say, yes, we're going to bring back our Jamaican brothers and sisters. Some of them may have the virus. Some of them may be asymptomatic. Some of them may be ill. If they are ill, we would want them to recover first before we take them back. They are asymptomatic. We will not know until we actually test them here. We can't rely on testing anywhere else. And then we have to house them. I want you to consider the cost as well, but they are Jamaicans. They are entitled to the support of the state, so we have to feed and house them. So, we're doing as best as we can to ensure that we bring them back home and that it is safe for them and it is safe for us.
Thank you, sir. Just before we get to the men from the media who want to ask questions, a number of persons on social media really asking for some clarification concerning the population, really the main cohort for those who go to church and bars those over 65? Are you saying that they are able now to go out to church and bars?
Let me be clear. Minister Mackenzie was not clear. He was saying they should not think about it. Under the Disaster Risk Management Act, there is an order which requires persons, I believe the order is now at 70, or we have brought it down to 65. AG, we have brought it down to 65. The order is now at 65. That if you are 65 years and older, that you should stay at home and that you should come out once per day to pursue the necessaries of life. You go to the supermarket, go to your pharmacy, get your medicine. If you do a little exercise, walk around, and then head back home. Some persons may view this as a great imposition. I visited my mother on Mother's Day and inquired of her how she was keeping the order to stay at home. And she said, "You don't have to tell me that. I understand that it is in my best interest because I have seen what has happened to one of my co-workers. You know, my mother used to work in the Ministry of Labor and Social Security, and she's retired, and many of her friends are retired. And she was pointing out that friends of hers that she knows who are living overseas have passed, have died from COVID-19. And so she's very much aware of the fact. And I know many Jamaicans of that age are very concerned and are abiding as much as possible by those orders. It is in their best interest. So as it relates to bar, we are not encouraging anyone 65 or older to go to the bar. Indeed, I'm not encouraging anyone to go to the bar. But certainly if you are 65 and older, the order still stands. So you should not be at the bar. It is a place that is not considered to be a necessity of life. Some people disagree. But
and church. As we then go to Damian Mitchell from The Gleaner. I'm sorry, Edmund Campbell first from The Gleaner.
Thank you very much. Good evening. Dr. Tufton, I see where you have announced that in the last 24 hours, 170 new samples were tested. I just want to find out, with the National Public Health Laboratory, as well as the National Influenza Center being able to carry out, I think, just over 2,000 tests. That's the total capacity I'm seeing. Just trying to figure out why is it that Jamaica is now carrying out more tests, particularly against the background of what we hear from the World Health Organization, that the only way we can conquer this virus is by testing. The next question speaks to a report today which indicates that someone from the National Public Health Laboratory was tested positive for COVID-19. Could you, first of all, indicate if that is so? And if that is the case, could you tell us how many persons have been placed in quarantine as a result of this development? And then give us an appreciation of how this will impact this very important facility, as you know, that not only carries out tests, but deals with blood tests and all these things in relation to the entire country.
Right. So the Chief Medical Officer is here, and I think she may be better able to give you some technical responses to your question. However, testing are done for or not filling the capacity could be explained in a number of ways. It could be a function of the samples that are collected at any particular point in time. I think it's important to look at the methodology and the approach to testing, which I've spoken to several times, and we believe that the methodology or the approach does give us enough to appreciate what is happening on the ground. But I want to ask the CMO to speak to that. On the issue of the public health lab and one person being tested positive, it's a matter of risk assessment. It really, whether or not you isolate a building or a floor, is a function of the contact tracing that is involved. And based on that risk assessment, then you make a determination. But Seymour, I think it may be wise for you to take on the testing question, given that you're the country's clinician and I am not.
Good evening, everyone. Okay, so first of all, I just want, a lot of people talk about the WHO saying test, 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 and a lot of people take that out of context because the WHO's call for persons to test, test, test is really in relation to the appropriate testing of persons and to ensure that countries do test all suspected cases and that they carry out their contact tracing and to do the appropriate testing for contacts. That is the context in which the WHO has called for test, test, test. So in relation to the number of samples that are coming in for testing, we do see at this time that coming out of the large backlog that we had in investigation of the Alarica case, that we did have we were doing 300, 400 samples per day because we had almost 2,000 samples that were coming out of that case investigation. So pretty much now having completed that, we have now gone back to pretty much our testing coming in from our suspected cases, the case investigation of the suspected cases, meaning the contacts that are traced, and we are testing both symptomatic and asymptomatic contacts, as well as our general surveillance in terms of doing our influenza-like illness sampling, as well as our severe acute respiratory infections and our lower respiratory tract infections in hospital. We recognize that the testing of the influenza-like symptoms, which is the ILIs, has decreased because many persons with mild respiratory illnesses are in fact staying at home. What we have done to try to get persons to be tested is that we have started an appointment system whereby persons who are at home with mild respiratory illnesses, as we have advised them to do, but they can make an appointment at the health centers to be tested. So throughout all the parishes, we have identified testing sites at our larger health centers, and persons are now able to register on the website for testing in those parish health centers. So our aim is to test all the influenza-like illnesses, whether or not they are coming to the health facilities or they are at home, they can also be tested. In addition to that, we recognize that many persons are still visiting their general practitioners, and we have been reaching out to the general practitioners in that to make contact with the health departments to arrange for their persons to be tested. So in relation to the severe acute respiratory infections and the lower respiratory tract infections, our numbers show that in hospitals, we are seeing those persons being tested. All of those persons from all hospitals are being tested. Now, we have made an additional move in saying that we are going to be testing admissions to hospitals. So our technical team have worked on a protocol, and we are now in the process of reviewing that, sharing that with our hospitals to see how we will phase this in, because we don't expect that we're going to start testing everybody at the same time. We're using a phased approach that have just come to me for review, so we will get that out into the system during this week to start that phased approach to testing. So yes, in fact, we are testing, but we are doing appropriate sampling of our population. And again, apart from the diagnostic testing, we will move shortly, as we have announced already to the public, into doing sampling of the population in terms of prevalence of exposure to see what is the exposure level of the population. And this testing we will do with the antibody testing that a lot of persons have been talking about. But I just wanted to emphasize that antibody testing, we are not using that for detection of disease now. We're not using it to say if you have COVID-19 now and you need treatment. We are using it to evaluate the population to find out if they have been exposed, because certainly from the testing that what we have seen, we know that there are a lot of asymptomatic persons. So our aim is to find out from that investigation how many persons have been exposed. And we will also roll that out in a phased basis, starting with, we are now at the procurement stage for those antibody kits, and we will start out with a validation process in our labs to validate the kits. Then we will also utilize the kits to test samples that we have of the population over the last couple of years to see what is the level of positivity that we have in those samples from previous years, so that when we get the positive rate from this antibody testing, we will know how much of this is actually due to COVID-19 and not to the presence of other coronaviruses or other viruses in the past. Thank you.
Thank you, CMO.
And CMO, you might want to just confirm that the yield rate from testing is just about 7% now. 7%. In other words, of all the tests that we have done, positive is about 7%, which is fairly good. And it is falling because we were at 10 at one point in time, 10%. And as we increase our testing, the number of positive cases have fallen.
Thank you, sir. Let's go over to Damien Mitchell of the Cleaner Company.
Thanks, Naomi. Prime Minister, the first batch of repatriated Jamaicans complained that they were hungry at the airport in Kingston. They were denied bathroom use and had to wait for more than 2 hours before departing for their St. Anne hotel. Has there been a review of the airport procedure for returning Jamaicans? That's question one. Two, can the minister with responsibility for education say whether there is a policy for student assessment during this period of distant learning? And if there is a policy, would he explain the details? Question three, is the Ministry of Health now in a position to say how advanced are the plans for the field hospital at the National Arena and who has the contract? And Prime Minister, you had promised to get some information in respect of the closure of the Administrator General's Department in Montego Bay, which had announced a 2-week closure. I'd be grateful if you can provide that.
Well, on the matter of the repatriated citizens, when I heard that there was distress as it relates to persons traveling and then not having any food here, that is a matter that we don't consider it to be a petty matter. We consider it to be one that we should have thought of, that should have been in place. And just this morning, I was informed that a walkthrough was done to make sure that everything is considered, because we want our Jamaicans to feel happy coming back home. It was not a deliberate oversight. The idea was that it would have been a quick process of deboarding, being checked, and then being put on the bus and moved straight to the hotel where they would have been refreshed. But there was some issues as it relates to paperwork, ensuring that they are properly documented at the from the Ministry of Health perspective. And that created a delay, an unfortunate delay. Today, we've completed the walkthrough. That delay has been resolved because much of that process now has been digitized. So we're not expecting that would be a complaint from our Jamaicans coming home. But I would say that if persons are looking for something to complain about, it will always be found, because we don't have perfect processes, and we're working under great stress. I don't think the public understands the level of logistics that has to be put in place to ensure the rendition in almost a seamless fashion. When we begin to explain, we would need 3 or 4 press conferences to explain the logistics involved in just ensuring that you move from the United Kingdom, you land here, you go through the process, and you end up at your hotel. I well understand the frustration of the people traveling back to Jamaica, especially the Mariela passengers. But it is not, and I have to keep saying this point, because the narrative is being given as if the government of Jamaica deliberately conspired not to have food for the people who came. That's not the case. Absolutely not the case. And the Minister of Foreign Affairs wants to come and add to that.
Thank you. Sorry, Prime Minister, just to add that there was refreshment served on the flight, although it was not a hot meal. So we had heard that there were persons who said they didn't have food on the flight, but it's not that they didn't have food, they didn't have hot food. But repatriation flights are generally no-frills flights. It's the nature of them. They're intended to move groups back home. They're not luxury flights. And we did provide sandwiches, water, and juice on the buses. So yes, it was a long flight, and persons were tired and frustrated, and clearly, you know, as indicated, that some complained about food. But you know, it's an unfortunate set of trying circumstances. As Prime Minister has said, we're working through the processes and the logistics, but I just wanted to correct the facts regarding the food, because I noticed it's been covered in some corners to say there's none, but what people want, what people expect may be a little different, and I'm sure the efforts Prime Minister has made will also provide even greater comfort. Thank you, sir.
I think, though, as a nation, I think we you know, there are greater concerns, I think, and we have to elevate the conversation in a time of crisis. That's what I would say. I have to answer the question, yes, but I'm very uncomfortable answering this question, which is broadcast internationally. Sorry, Minister Samuda.
Hi, Damien, how are you? The fact of the matter is that we engage in predictive assessment, which is the basis on which we made our proposal at the meeting with the CARICOM ministers. What we do is we take the previous year's assignments, for easy language, and we assess the extent to which they are performed, because we realize that they have been greatly challenged this year. Some didn't have internet connection in communities that are not served. So because of the disadvantage that they were placed in, we have been promoting the notion that it would be appropriate for us to look at their SBAs, which is the student assessment assignments that they have been given and how they're performed over the year, and then also what they did last year, like in the case of Cape. University of the West Indies is accepting Cape based on their assessment from their work last year. So it is on that basis we think it is the fairest approach to helping the students who have been challenged because of what has happened and the closure of schools. So it's a continuous program of assessment that is on the go.
Thank you, Minister.
I see it's moving, but I don't hear nothing.
I'm sorry, is there a third question real quickly?
No. Minister seems to be answering different or responding to a different kind of question. I'm asking for the persons who are now in distance learning, not those who are doing CAPE or PEP. I want to know whether there is a policy for their assessment.
Remember that those who are engaged in PEP and CAPE are also engaged in distance learning because they're doing it through electronic means, online learning. The ones that are challenged in terms of the high school system and primary care, yes, of course, what we are doing and what we are hoping to do is to enable the period just before they resume in September and shortly thereafter to do an assessment of all those students with particular emphasis on the grade 6 students who are transitioning into high school. That is the area of greatest concern right now. But also those in the primary care system that will need shoring up because they have lost so much time by not having all the facilities at their disposal. So we keep them in a position ready to accept the challenges of moving up into a different grade.
Thank you, Minister. I see the time. Prime Minister will take two further questions from the media, and I have a few from social media.
Please,
yes.
just to respond to the third question about the field hospital, I was just told that it is on track, that a contract was signed with Rogers. It's not signed yet. It was finalized with, what's the name of the company? Rogers Construction or something like that. Rogers Construction. And it is a project that will be supervised by the Jamaica Defense Force. I think that was announced some time ago. So that is my understanding.
Thank you. Prime Minister, we have one follow-up from Brittany Clark and then two other quick questions for you from the media, but I see a couple from social media that are recurring concerning just clarification again. There are people who have bars and restaurants in one and are trying to understand really what the protocol is, given that persons shouldn't really congregate at restaurants in particular.
Right, so
I beg your pardon, from social media, again, the other concerns, I don't know why all these questions on social media, concerning the racing industry, when racing will resume.
So
well.
the racing industry and the quick service restaurant industry, those protocols will be considered. We have developed, as you would have known, and we have announced the JAM COVID Economic Recovery Task Force. And I suspect that that would be one of the areas in which they would have looked at in terms of looking at the quick service industry and the protocols that would enable the reopening of the industry as it relates to being able to have persons seated in the restaurants to have a meal. The bar protocol, if you notice, says no bar stools or tables or chairs within the confines of what is determined to be the bar. And so we considered very carefully that there were some bars that also had a restaurant attached to it, or maybe had a corner shop haberdashery facility attached. And so there should be no gathering within or consuming within. So the reopening of the bars should not be interpreted to mean the reopening of restaurants for in-restaurant dining. They can still continue with their takeout and delivery.
Thank you, sir. All right, let's go to Kirk Wright from TVJ.
Thank you very much. Prime Minister, you hinted at it earlier, but just so I'm clear, are all the persons who come back on the control reentry program, are they all tested? Question number one. Question number two might be for the health minister. I remember the case of Jodian Ferran, and coming out of the post-mortem, it was said that it was after 20 minutes she was found on the floor in the ICU department. I'm wondering if there's any consideration, since we always have problem of finding ICU nurses, if there is a consideration to use cameras in these facilities, so we will help to alleviate the problem of having to find ICU nurses.
Okay, so I'm not going to link your conclusion or assumption which led to the question because I'm not clear as to whether the unfortunate incident which precipitated, well, all that we know about Jodian, whether or not she was on the floor for 20 minutes. I can't say, and I'm not going to comment on that. But as it relates to ICU nurses, it is a fact that we have had a long history of shortages in a number of areas, actually. Specialist nurses, about 8 categories, largely because of international recruitment once they are trained. In fact, we lose somewhere in the region of 500 specialist nurses last year. We have engaged in a number of programs to try and alleviate that shortage. For one, you would have seen a number of Cuban professionals coming in just after COVID. The COVID response was announced, 150 to be exact. They are all either doctors or specialist nurses, a number of them ICU nurses. In addition to that, over the past year, we had started 2 programs, one in collaboration with the UK government, another with China, where our nurses would be trained, specialist nurses, trained for a period here in Jamaica, and then dispatched to those jurisdictions to work, and in particular do clinical rotations in hospitals in those countries under the supervision of their trainers who would accompany them to those jurisdictions. So we had our first two batches, one from the UK, one from China, returned home, and they would have strengthened that complement. So the intention is to expand on that over time. In addition to that, the University of the West Indies has announced the doubling of its nurses training program, and they are to construct a facility for that purpose. So we are working on expanding our cadre of nurses, but just to point out, part of the shortage is linked to the international recruitment based on the quality of those nurses and their performance over time in other jurisdictions, plus the package that is being offered.
Thank you, Minister. A penultimate question, Zara Burton, 18 Degrees North, and then we'll have the follow-up from Brittany Clark at Nationwide. Ms. Burton?
Good evening, everybody. Question for the CMO. I have 4 questions. Question for the CMO. Last time, 89 children, I think, were said to be COVID-19 positive, 0 to 19 years old. It seems like at the time it was almost 20% of cases were children. I just want to get a sense of how that compares internationally, because we keep hearing that this doesn't affect children as much. And you'll see news articles that say 2% of cases are children, 1% of cases are children. So I just wanted to understand if those numbers are correct, and why is it that we seem to have a disproportionate number of cases being children? That's 1. 2, public sector workers, based on layoffs in the private sector, are there likely to be any public sector worker layoffs? That's 2. 3, from the 64 million in quarantine expenses that was announced recently, who are the beneficiaries? And when organizations or companies rather like Sandals, Jakes offer their places for quarantine, are they offering it for free? Does it come at a cost? But specifically, who are the beneficiaries of the 64 million? Also, lastly, and this is for the Prime Minister, how did the Sandals Foundation come to be giving the MPs 500K each for their constituency funds? How did that come to be?
Thank you. CMO?
Okay, thanks for your question. Okay, so essentially we define a child as from 0 to 17, and we have had, in fact, 57 children that have been affected so far with COVID, who have been COVID-19 positive. So the majority of these children really came out of the investigation with the workplace cluster. I think we had 37, and in fact 38 in all in terms of the workplace cluster investigation. The majority of these children were asymptomatic. We had 13 children that were actually admitted to hospital. And of those 13, I believe we had 7 that were symptomatic, and these were with mild symptom, except for one case, the unfortunate case that we had of a child who did actually pass. The other children are mildly symptomatic children, and so of the 13, 8 have actually been discharged home, and we presently have 4 in hospital, and of those, one child is symptomatic. We have several children. I think we have 17 at one national isolation facility, and we have 5, I believe, at another. So yes, we have been seeing children that have been affected, and I think Jamaica's progression in the outbreak reflects what is happening in other countries, in that initially we were not seeing children that were affected. But as time has gone by, and especially in doing our case investigation, which many of it would be sampling of asymptomatic contacts, that we would have been picking up children in this. Fortunately, we have not yet had the experience that is now being revealed through the case studies that are happening out of the UK and in the US, where they are seeing you are having inflammatory disease in children that are affecting the blood vessels and causing some serious outcomes. We have not yet seen that. We continue to monitor closely our children that are in hospital and to do our surveillance, including the severe acute respiratory infection surveillance among our children. Thank you.
The question was about how did the contribution from.
So
it was not a request from the government. So it was an offer. Obviously, Sandals would have seen the situation and thought that they wanted to assist. And let's be clear that members of parliament are literally in the field on a daily basis giving out packages. If you needed to mobilize widespread distribution of care packages, the standing machinery of members of parliament would be a very effective way of doing it. This is, however, and I want to change the narrative and the characterization, this is not a gift to MPs. This is a gift to constituencies. And the best way to do it would be through the structure of the Constituency Development Fund.
Sir, I believe there are two other questions concerning public sector.
Yes, the figure is 31.5 and not 64. 31.5 million was the gift. And look, we say thanks to all Jamaicans who have contributed and continue to contribute to the process. And we encourage more Jamaicans to give in this time of need. In this time of need, we have to be grateful when persons recognize their social responsibility and step forward to contribute. And in Parliament, I have acknowledged not just Sandals Foundation, but several other Jamaican companies right across our society who are making contributions.
Thank you, sir. We have a follow-up. I believe there was a question about public sector workers, if they'll be affected, from Ms. Burton.
Listen, there's a reality that we keep dancing around. And that reality is we must ensure that our economy gets as close as possible to full capacity. If we don't get our economy to full capacity, the little savings that exist for the Jamaican middle class will be evaporated in a matter of weeks, not even months. For those people who depend on the constant hustle, that can't get out there and make a living, whatever daily savings they have, that will evaporate. And so too will the government's revenues from taxes and other areas. So let us not fool around with the understanding that we must return our economy to as close as capacity as possible. Right? Jamaica does not have the luxury of other economies that have large savings. So more than other countries, Jamaicans have to learn to live with the COVID pandemic. More than other countries, Jamaicans must be faithful and responsible in following the orders given, because that is the only way that we're going to return to our full capacity economy with a new normal. As it stands now, thanks to the good management of the government, and the Minister of Finance is here, but I'm told I should not call him up to the stage. But thanks to the good financial management of the government, and in particular the stewardship of the Minister of Finance, for the first time ever in a crisis like this, we have been able to put forward a cash transfer showing that we care to persons who have been displaced from their jobs and for persons who are not employed. And in the good management of our finances, public sector layoff is not something that is within our contemplation. But let's be clear. that if we don't get back to as close as possible to capacity, and very quickly, then as the Minister of Finance likes to call it, the second and third order effects of the crisis would be incalculable. I think that answers the question.
And sir, a final question, follow-up from Ms. Brittany Clark from Nationwide.
Okay, hello, good evening again, Mr. Prime Minister. Okay, two quick questions. Firstly, entities in the tourism industry are announcing that they will reopen in June, while others have actually started accepting bookings. Has the government facilitated or finalized the decision, rather, to open the tourism industry, and have assessments shown that we are actually ready? And the second follow-up is for Minister or Senator Johnson-Smith. There were suggestions made that the government would be sued over the human rights concerns regarding re-entry of Jamaicans. Has the government actually received any formal notice of such suit? Thank you.
Well, the question you ask is almost providential, because just today in Cabinet, the Minister of Tourism, who is here awaiting his call to the podium, presented protocols, which over a month and a half ago, I had asked him to start working with the industry to put together those protocols to restart our tourism industry. Tourism is our major foreign exchange earner. Major foreign exchange earner. And with the closure of the global tourism industry, we had no choice here but to close our hotels and to close our attractions. But we must be prepared for the day when we reopen. We will not allow the crisis to cripple us to the point where we don't take proprietary action. And we have to be timing very carefully, because other countries are going to reopen and people are going to travel. And Jamaica must be the #1 destination for travel. That is how we recover stronger from crisis. Other countries, to our certain knowledge, have started to prepare their own protocols. What will happen at their airports? What will happen from airport to resort? What will happen in resort? So Jamaica must be ready. And the people who work in the tourism industry, over 100,000. The minister tells me 106. Come on up here, minister. Right? 170,000. They are here waiting. When will we reopen? We have not given a date as yet, because we have appointed a broad stakeholder-based economic recovery task force, and the protocol is being studied by the task force, which has the Ministry of Health on it, and we have to make sure that all the health protocols especially are at a point where they can mitigate any risk of reopening. And whatever protocols are finally decided upon, as we have done with all the others, we will go into public discourse. We'll give some time for the public to look at it. Then we will start with a trial phase, and then with a final reopening once we have ironed out all the issues that would throw themselves up in a trial phase. So just to be clear, yes, the government is contemplating the reopening of the tourism sector. We would be, should be very satisfied, I think, that the government is contemplating that the protocols are far advanced but not yet finalized. We have not yet settled a date, but one would want to be able to time that date to meet when other countries are likely to reopen. Minister?
Thank you, Prime Minister. I think the PM has hit the nail strictly on the head. The industry is critical, not just to our economy, but the global economy. The truth is that when the pandemic hit, very few people thought that the impact on tourism would be as crippling to global economy as it is today. I just read where one of the richest economies of the world, Saudi Arabia, is now going to be putting heavy taxation as a result of the impact of COVID-19 on that particular economy. And they were spending $500 million only 3 months ago on the expansion and development of their tourism sector. So we in Jamaica have had the experience where Prime Minister indicated 170,000 workers, and 153,000 of them are now without a job. That is very significant for us, and therefore to get back the economy going and quickly is the priority. The team Prime Minister has been working assiduously in this regard. All of our stakeholders, the hoteliers, the airlines, the travel agents, and the attractions, we've established perhaps one of the strongest teams ever assembled for the business of building the tourism fabric in our country. And we are satisfied that within a short period of time, and in consultation with all the stakeholders and partners, and as the PM says, in line with our Caribbean partners too, in terms of a time for reopening, that we will be able to announce very, very shortly a specific date that we will begin opening tourism for the entire world. I thank you very much, Prime Minister.
All right, I think we have answered all the questions, are they? Minister Johnson-Smith, do you want to respond to the lawsuit issue? The question was, no, we haven't received any indication of such a suit, no. I want to thank you for listening. Thank you, Jamaica.
Thank you so much, Mr. Prime Minister and members of the Cabinet, and of course the Permanent Secretary in the Office of the Prime Minister and the Permanent Secretary at the Ministry of Health for joining us. Thank you, everyone, and have a good night.